My name is Christer Moynahan, and I'm the Chief Program Officer for Rebel Recovery, located in Palm Beach County, Florida. We are a grassroots, peer-led recovery community organization guided by harm reduction principles, and we seek to improve the health of people who use drugs or are impacted by substance use. Our approach is to meet people where they're at and celebrate any positive change. We are one of the few hybrid recovery community organizations in the United States because we offer syringe and harm reduction services alongside peer recovery support programs. Our mobile syringe and health services program serves as a point of entry for many to engage in a range of services, and our peer support is about building connections through shared lived experience. We support any path by any means, and this becomes the bridge between chaotic use and stable living for many we serve. As a person in recovery, I understand this journey looks different for everyone. I know what it took for me to get where I am today, and now I use my experience to support positive change in others' lives. The addiction and overdose crisis is complex and must include community-driven, multifaceted solutions. The Bloomberg School of Public Health has propelled my work in this area as a public health professional and supported the growth and impact of my organization.
Hi, I'm Fola Akinnibi. I'm a reporter with Bloomberg News, and I'm here with Jacqueline Romero. She's the U.S. Attorney for the Eastern District of Pennsylvania. She's been in that role since June of this past year, though she's no stranger to the office. She worked as an assistant AUSA in that office for about 16 years. So thanks for joining us, Jacqueline.
Thank you, Fola.
We'll get started. So life-saving treatments like methadone and buprenorphine can really help people who have opioid use disorder, but there are barriers to that care, and I was hoping you could talk a bit about some of those barriers and what your office and the Department of Justice more broadly is doing to ensure people have access to care.
Sure. Well, the Department of Justice takes a three-pronged approach to the opioid crisis. The first part of what we do is education and outreach, going out in the community and talking to individuals about the real risks. We work with our partners like DEA on their One Pill Can Kill campaign. And the second part of what we do is what people mostly know is our enforcement. And we go after the drug traffickers and people bringing the drugs into this country. The third part is what you're referring to is the recovery part, where people are legitimately being prescribed medications for opioid use disorder and are on their avenue toward recovery and care. And the Americans with Disabilities Act defines opioid use disorder as a disability. And so there are protections that we're able to enforce as the department to help those folks. There's a stigma around treatment. If you're on methadone and Suboxone or these other drugs, a lot of employers and other groups may discriminate against you. And so we can use the American with Disabilities Act as a tool to assist people in recovery.
So it sounds like you guys see this as a civil rights issue, and I was hoping you could talk a bit about the sorts of areas that you guys are using this sort of legal argument and the types of cases that you guys have brought as well.
Yeah, well, if you look at the Americans with Disabilities Act, there are three titles that we primarily enforce, Title 1, 2, and 3. Title 1 covers areas of employment. So if an employer discriminates against someone who is on legitimately prescribed medicine for their opioid use disorder, both EEOC and the Department of Justice can get involved. The second title is state and local governments. So the typical cases that we see there are sometimes in prisons and access to medically assisted treatment in prisons, in things like probation departments. Sometimes they have hard and fast rules saying you can't use medicine to treat your opioid use disorder. You have to be completely drug-free. And then Title III of the ADA covers goods and services, essentially, places of public access. And so When you think of, again, employers that discriminate might fall under Title III and other types of goods and services. So those are typical kinds of cases we would bring.
And do you see other areas where the DOJ can help and perhaps step in to help ensure that people are able to get the care that they need?
We've brought many unique types of cases. So in medical settings, sometimes nursing homes, for instance, might have a blanket policy. We don't accept people who are on medicine for treatment of their addiction. That's an area that we've stepped in before. Sometimes zoning laws, believe it or not, if there's a treatment facility that wants to be located in a particular neighborhood, and the town is treating them different than they are treating other similar facilities, we might get involved because that's discrimination. So it can be a lot of unique scenarios where the Department of Justice steps in to really get rid of those discriminatory barriers to recovery. That's the ultimate goal at the end of the day, is to remove that stigma and remove the discrimination so that people can get on the road to recovery a lot faster.
And correct me if I'm wrong here, but it seemed like in some of the cases that I've seen that you guys have taken on, it looks like you guys want to ensure that people who are already in care or people who are already using these medicines can continue to access them in the setting they need, and they're not discriminated against. But I was wondering if you felt like there was room for you guys to ensure that people who may need in the future, or that they would have the option for care going forward.
Yeah, that's really up to doctors, and that's beyond my expertise, because now you're getting into standard of care. For instance, in the prisons, if someone is on medicine for their addiction, when they walk in the prison door, we have to ensure that they continue to have that treatment while they're in prison because they were previously on it. Just like we would have someone who's on, let's say, epilepsy medicine, they continue their treatment while they're in prison. But to say that someone who comes into prison who's using drugs illegally should then get put on medically necessary treatment is a standard of care issue. And that's really up to doctors and experts in the medical field to talk about standard of care and what should be the standard of care. That's not up to the Department of Justice.
It looks like that's all the time we have, so thank you so much for taking the time.
Thank you for having me.